although I had the bank as president, I'm in fact an employee of the State Bank of Pakistan. And there I headed for some years the remittances, the payment systems, mergers and acquisitions, banking policy, deposit protection. So whenever you use the POS somewhere, you use your ATM or you use online transactions. So I should be the person behind those initiatives that have taken place over the years. And for the Aga Khan guys, I am a patient registered in Aga Khan. I'm about to be operated in a few days' time. So Aga Khan ko to main kuch kehne nahi laga. So I will not, say, Aga Khan, you guys are great. So here I am, based on my experiences, both as a regulator and as a commercial practitioner, here to talk about, how to, make healthcare affordable. I say most importantly, having come from a deep down financial background, two things are practically very, very important. The first and the foremost is efficiency, how efficient you are in the services that you provide. And two, how do you manage costs? And if you are able to address both these issues simultaneously, you are able to serve your customers or your patients for that matter in addressing affordability of whatever service that you provide. And health services, another health affordability. You are being operated, you are being called by the doctor, you are being sent for medical tests, whatever they are. And lately, over the years, what I've learned is the two things that are gradually getting very, very important, and most of the countries have adopted them. We have done that, and that is the adoption of governance, better corporate or IT governance, as we used to say at the State Bank of Pakistan, better corporate governance and better IT governance, and the eradication or complete abhorrence, I would say, non-use of paper in your day-to-day working. If you are able to do that, that can create a lot of efficiency. Although I'd like to delve upon a bit on the expense to GDP, the amount that we spent on health services in Pakistan, that is only about 1.2% of the GDP, And that is only about, so we are not a great economy from that. We are only about $380 billion per annum, and if we take 1.2% of that, that's the amount the government spends on each one of us every year. So maybe guys of your stature should not start to lobby on the expense that the government incurs on each one of us in Pakistan. And there may be a few exceptions, but here, I think a very, very strong lobbying of your groups is very, very important. Last year, when I was heading Russian digital account, the main remittance initiative from non-residents Pakistanis to Pakistan, I had the opportunity to address APNA, the famous association in the US, and I found the doctors very, very energetic and very active. I believe most of you, especially the specialists, would have gotten your qualifications from the US or from the UK. The Pakistani doctors are very important people, and they are very important because of that association, because of being members of APNA. And they have used that association for the benefit of the doctors community and for the people of Pakistan. So they are not only serving the US patient base, they are also serving Pakistanis by sending remittances. They have partnerships here. So the second objective that I like to recommend is partnerships. I mean, you guys are doctors, administrators, CIOs, and all of us are part of a particular profession. So why not, guys? Let's try to explore partnerships. Can we do that? And partnerships, it's so important to enter into partnerships because it brings in efficiency. So I would like you to consider more emphatically the role of public-private partnership. I think easier said than done. It's not easy because let's admit that the private sector is much more efficient than the government. Uh, Having been a regulator for most of my career, one of the severe limitations of working was the limitations of the government because of the bureaucracy, because of audits, because of NAB, because of certain institutions that stop the working of government bodies. So you guys who are professionals, who are better trained, better educated, and have better exposure to the rest of the world, are very much in a position to guide the rest of the Pakistanis, especially our hospitals and staff who are not that educated, do not have that kind of exposure that you do, is to enter into partnerships. And those partnerships do not have to be wholesale partnerships. They can be very, very, very simple partnerships to begin with. Maybe a technician, maybe a lab attendant. It does not have to be doctors merely. I think very important functions are done by your nurses, by your technical staff, by the people who carry out your biomedical equipment, those who do CT scans, X-rays, so whatever way you guys can come up with solutions for the welfare of the people of Pakistan, that is going to make life much more easier for each one of us. And if, like I said, if you improve efficiency, you reduce costs. And that is what is going to make things more and more affordable. A few years back, in my position, we were actually worried about lack of banking facilities in the areas of Waziristan, for example, in Cholistan, areas bordering Iran, Afghanistan. Pakistan is a big country. We are 250 million people now, as the census say. So how do you get along? How do you get to those people who don't have that? So a lot of cross-subsidization takes place, which I'm sure mega hospitals understand what cross-subsidization really is. But most importantly, it is important for government functionaries and government-owned hospitals to start to explore providing health services, just like financial services, to the far-flung areas of Pakistan. Because if they have to travel, I come from a village very close to Jhang. I'm very close. I'm about 40 kilometers from Faisalabad, about 50 kilometers from Keynote, about 200 kilometers from Lahore. So anybody who has to make a journey from my village to Lahore definitely needs a couple of thousand rupees just to get to Lahore. And then to talk to a hospital. So it is important that we take the health services, just like the financial services, to the masses where they actually emanate from. That will definitely reduce costs. And if you look at, I'd like to address the use of paper here now. So I'm taking more of my time. I think I'm being pragmatic, Shaukat. I'm just trying to take you where it really moves. मैंने डॉक्टर को दिखाना था few days back, so I waited. Like I said, आगा खान वालों को मैं कुछ नहीं कहूँगा, but I waited, for about 45 minutes, and I was given that token. I was waiting. It was about after 45 minutes I finally had to go. I said, guy, I've been waiting here for 45 minutes. How long? What else do you want from me? He said, sir, आपकी file नहीं आई. Now that's while वाकई नहीं आई, which is, I think it's so important to understand the spirit of sir file nahi hai. He didn't know who I am, obviously. There's no point in introducing yourself to a functionary who is trying to do a good job. He's doing a good job. But how do you move files from one place to another? That is the inefficiency part, and that is what enhances cost. Now what we have done at the State Bank of Pakistan is that हम भी फाइलें मूव करते हैं. सरकारी अफसर फाइलें मूव करता है, वो पुट अप करता है फाइल, उसके ऊपर 10 बंदे साइन करते हैं. Is that a very efficient way to do things? आजकल we should be not talking about digital movement of things. We should be talking about digital signatures. We should be talking about digital authenticity, isn't it? So 45 minutes wouldn't have been wasted. The appointment was taken at least 3 days earlier. So the operatives exactly knew this guy is coming in. You get a call from Aga Khan that, are you coming, sir? You say yes or no. So that efficiency, that 45 minutes of mine is precious. and it is precious for each one of us. Most importantly, file आई और file अब किसी ने अगर पढ़ी नहीं, so that's another issue. That happens in my organization also. File moves in, कोई फाइल पढ़ता नहीं, it's just a movement of files. It makes no difference. बिल्कुल ऐसा ही है जैसे we join presentations without preparing for that presentation because we know somebody else has done that for us. So we do it. So this is what we do, this is what you do, this is what the rest of the world does. But what happens with technology? You click on, आपको message आता है, वो कहता है, the sender wants you to acknowledge you have read it. So when you sign something, that is where authenticity comes. That is where you cannot hide behind that मैंने पढ़ी नहीं. At least then you'll read it. You'll say, yes, I've signed it. I want to do it. So it is so important that please get rid of papers, get rid of files. It will create efficiency. Get rid of such working atmosphere that you do not need. You do not need, that will bring a lot of efficiency into the system. It will bring responsibility, credibility, and it will also lead to better provision of health services. Now, lastly, what I would like to say is that sorry, Shaukat, just one last point. I think I have a lot to say. I wish I could say more because I'm a practitioner. मैं करता हूँ. I walk the talk. So that's the difference. Russian digital account happened. We brought in $7 billion. I'm standing here talking to you. We have done data analysis. We know what it means. So guys, last point that I'd like to share with you, again purely from pragmatic, what we have done and accomplished, that is that you get a lot of data, tons and tons of data that walks in. You have to start to analyze that data, collate that data. I mean, मैं आपको डराना नहीं चाह रहा, but for you to understand things better, I've represented Pakistan at the FATA forum. I was the lead. So, but मैं आपको डरा नहीं रहा from AML CFT contact point of view. But if you carry out a transaction in NCB and you carry out another transaction at HBL, that data is collated. That data gets somewhere in the middle और उसको analyze किया जाता है. That is why AML CFT is addressed. जब हम अमेरिका से पैसे पाकिस्तान भेजते हैं तो अमेरिकियों को पता होता है कौन भेज रहा है, किसको मिल रहा है. And that is why you see, so the inefficiencies that arise are not because of the payment systems. Inefficiencies arise because that data is analyzed और उस data से उसको पता चल जाता है कि यार this guy is an AML CFT risk, for example. So this is something that I would request you that you do, that your files carry a lot of information. I'm sure all hospital files carry a lot of information. But how is that data used? How is that collated? And how does it become a predictable model for the future? मेरे 500 टेस्ट हुए तो now you should be able to tell me कि यार मुझे किडनी की प्रॉब्लम तो नहीं होने लगी, मेरे दिमाग में तो कोई मसला नहीं होने लगा, मुझे हार्ट प्रॉब्लम तो नहीं होने लगी. The doctor should be able to use that data that you have of me. And you don't have 1 year data. You have 20 years of data. But that data is all in files which nobody reads. It's not in the system. So it's so important that we start to use data that will create efficiency, bring costs, and that cost can be passed on to the patient. And that is why it is so important. And similarly, if you lobby, please lobby to the government. उन्हें कहें यार हमें पैसे दो. We need it, and this is where the competition arises. I was listening to this lady from Harvard. I've been to Harvard. I haven't been a student, but I've been a fan, always following Harvard. Rating hai, they get rated. That is why they get government funds. Harvard gets the most funds in the US from the US government because they are rated the best university in the US. All Ivy League पैसे इकट्ठे कर दिए. आप लोग भी करें. That is the way to lobby. But you have to tell them that मेरी rating कैसे? If you don't have a rating, I believe you need a rating. You need responsibility. हमें कहना चाहिए कि यार ये hospital, ये clinic, ये A rated है. ये B category में fall करता है. ये C में करता है. ये D में करता है. Start to give numbers. And that will create efficiency and funds. Thank you so much.